Hello and welcome to Cajon Valley Union School District's Return to Campus training video. The following guidelines will bring you up to speed on current health procedures so that you can have a fun and safe return to campus. The guidelines are based on CDC and public health recommendations and are in place to keep our community and students safe. Information presented is up to date as of the date of the recording. However, guidelines from the CDC change frequently, so be prepared for regular updates. Ideal scenarios are being presented in this video. However, each site administrator can use the following to do the best they can with the available resources. 4 pillars to minimize risk of spread. The first pillar is time, how much time you spend together. The second pillar is distance, the distance between each person. The third pillar is barriers, what's dividing you. And the fourth pillar is age. When we can't control all 4, strengthen the others. Do as much as you can. Here are a few examples. If teachers rotate between cohorts of students, have the teachers wear facial coverings and have their temperature checked routinely throughout the day. For service providers who have multiple sites, have temperature checked when they arrive at each site throughout the day. Another example is if you need to be within 6 feet of each other for more than 15 minutes, increase one of the other pillars such as barriers. For example, both people wear a face mask and use a physical barrier such as a clear plastic partition at the end of the desk. Another example, if a staff member needs to remove facial covering for an assignment, increase the amount of space between the individuals. For example, have teachers and students spaced 8 feet apart instead of 6. Another example, provide distant learning options for those at higher risk for COVID-19. COVID-19 is thought to spread mainly from person to person between people who are in close contact with one another within about 6 feet. It is spread through respiratory droplets produced when an infected person coughs, sneezes, or talks. Droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Recent studies have suggested that COVID-19 may be spread by people who are not showing any symptoms.
People with COVID-19 have had a wide range of symptoms, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19. Staff or students with any of these symptoms must stay home. Fever of 100 degrees or higher, cough, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. This list does not include all symptoms and will be updated as we learn more about COVID-19.
There are many safety actions that our school sites can take to help minimize the spread. These safety actions include post signs on how to stop the spread of COVID-19, properly wash hands, promote everyday protective measures, and properly wear a face mask, designate routes for entry and exit using as many entrances as feasible, put in place other protocols to limit direct contact with others as much as possible, minimize movement of students and teachers or staff. For example, consider ways to keep teachers with one group of students for the entire day. These are steps you can take to minimize the spread. Maintain good social distancing at least 6 feet apart. Avoid touching your mouth, nose, and face. If you are in a private setting and not wearing a mask, remember to always cover your mouth and nose with a tissue when you cough or sneeze, or cough into the inside of your elbow. Avoid close contact with people who are ill. Do not gather in groups. Avoid crowded places and mass gatherings. Stay home as much as possible. Remember that some people without symptoms may still spread the virus. Keeping distance from others is especially important for people who are at higher risk of getting sick.
As we get ready to welcome kids, it's important to think through the intentional work it takes to make sure kids feel like they belong, they're valuable, and they have what they need to be safe and successful. Site administrators and designees will need to work with staff to ensure there's a plan for building community in classrooms, teaching, providing opportunities for practice, and reinforcing the procedures covered in this video, checking in with students and responding to feelings of concern, and checking in with staff to find solutions for glitches and challenges along the way. The Site Procedures document contains resources to help with the journey. A plan for an intentional welcome and clear structures will provide students and staff the foundations for physical and psychological safety.
All employees, students, and visitors will be required to submit to symptom screenings prior to being admitted to district facilities or engaging in work, school activities off-site. Screening will include responding to a series of questions on potential symptoms and a temperature check. The specific questions and temperature threshold will be based on current guidance from public health agencies. Employees will also be encouraged to self-screen before leaving their homes and to stay home if they have any symptoms associated with COVID-19. Parents will be encouraged to screen their children before they leave for school each day and to keep children home if they have any symptoms associated with COVID-19. Visitor access to district facilities and schools will be restricted to activities that require in-person transactions. Require all persons entering district school facilities to submit to symptom screening. Secure entrances to the campus to prevent entry before screening begins. Screening should consist of a series of questions to determine if the person experienced any symptoms associated with COVID-19. These questions include: do you have a new cough, nasal congestion, or runny nose? Are you experiencing shortness of breath or difficulty breathing? Are you having new muscle pain or fatigue? Do you have a headache that is not normal for you? Do you have a sore throat? Are you experiencing a new loss of taste or smell? Are you experiencing nausea, vomiting, abdominal pain, or diarrhea? Do you have a new rash? Have you been exposed to anyone who has been tested positive for COVID-19 in the last 2 weeks? A temperature check for fever over 100 degrees Fahrenheit must also be completed.
To ensure everyone's safety, there's a new daily check-in process. Parents will pull up out front for drop-off in the pickup area and remain in their car while staff performs the health check and signs the child in for the parent to avoid any contamination with pens. Ask all individuals if they or their family members have had any COVID-19 symptoms in the last 48 hours and if anyone in the family has had a positive COVID-19 test in the last 14 days. Exclude students if they answer yes to either of these questions. Conduct visual wellness checks of all students and take students' temperature with a no-touch thermometer. Document temperature on roster next to child's name. Children are escorted to the classroom by staff members after check-in and for check-outs.
These are the steps for transportation staff and parents to take for students who ride the bus to and from school. Encourage parents to screen their children for symptoms before leaving for the bus stop each morning and to keep their children home if they have symptoms. Encourage parents to wait with their students at the bus stop until they have completed screening and entered the bus. Require that students wear face coverings at school bus stops. Symptom screening. Train and equip all bus drivers to screen students for symptoms before admitting them to the bus. Do not allow students with symptoms to enter the bus. If a student cannot be admitted to the bus due to screening and their parent is not present, deny entrance to the bus, place a face mask on the student, move the student away from others. Attempt to contact parents through dispatch to request their return to the bus stop. If unable to contact, place the students on the bus with as much room around them as possible. When arriving at the school, identify the students to the school's health office while minimizing their exposure to other students. Bus drivers will require the following items for screenings: face covering, face shield, disposable gloves, non-touch thermometers, hand sanitizer for the driver and students, trash can, and disposable masks. The district has purchased non-contact thermometers for each school site. Each thermometer will come with a quick reference instruction sheet for staff to reference.
Hand washing is an important measure to prevent the spread of COVID-19. Students and staff should wash their hands before and after preparing or handling food or drinks, administering medication, diapering, using the bathroom or helping a child use the bathroom, coming into contact with any bodily fluids, playing outdoors or in the sand, or handling garbage. Students and staff should wash their hands for 20 seconds with soap, rub thoroughly after application, and use paper towels to dry hands thoroughly. When hand washing is not practical, students and staff should use fragrance-free hand sanitizer with at least 60% alcohol. Sanitizer must be rubbed into hands until completely dry. Remember, frequent hand washing is more effective than the use of hand sanitizers. Children under 9 should use hand sanitizer under adult supervision. Call poison control if consumed.
The virus that causes COVID-19 is not transmitted through contact with skin. Disposable gloves do not offer protection from COVID-19. Employees should wash their hands or use hand sanitizer frequently to keep from transferring the virus from their hands to their face. Disposable gloves should be worn only in the following situations. When stated by the manufacturer for safe handling of certain cleaning products, gloves will be included with the cleaning supplies available to employees if indicated for the product that will be used. When contact with body fluids is possible, by staff who interact frequently with members of the public, when receiving documents or other transactions, by staff engaged in screening employees, students, and/or visitors for COVID-19 symptoms, by employees who are responsible for interacting with persons who are known or reasonably suspected of having symptoms associated with COVID-19, such as health office and isolation room staff. Here is a video showing how to remove soiled gloves.
So our goal is to remove our gloves without getting the stuff that's on our gloves on our skin or on our scrubs. So what we're going to do is we're going to take our thumb and our index finger and we're going to pinch the cuff of one of the gloves. Then we're going to take the glove and peel it off, and we're going to grasp the glove completely in our hand and close our hand tight. Prevent it from hanging down because we don't want to touch it. Then we're going to take our index finger of our ungloved hand and we're going to slide it underneath the cuff of the glove, and we're just going to peel it off, and it puts it in a nice little bunch, and then we're going to throw it away and wash our hands.
Face coverings prevent the spread of airborne moisture particles that could be inhaled by others by trapping them in the wearer's face covering. Face coverings do not protect the wearer from inhaling contaminated particles, so physical distancing must always be maintained, even when wearing a face covering. Because COVID-19 can be spread by people who are not experiencing symptoms, face coverings must be worn by all employees while on district property or when working on property. Students and visitors will also be required to wear face coverings. Exceptions to this rule include when a person is working alone in a single workspace with the door closed, in a vehicle that will be used exclusively for the driver, eating or drinking, working alone outside in an area where it is unlikely that others will come within 15 feet of the individual.
Students and staff should be reminded not to touch their face mask and to wash their hands frequently.
There are different acceptable forms of face coverings. Washable face covering. Washable face coverings are appropriate for all situations. Disposable mask. Disposable masks will be provided to employees, students, staff, and visitors when they forget to bring a washable face covering. Disposable masks are not superior to washable face coverings. Face shield. A reusable face shield should be used in place of a washable face covering under the following circumstances. When a person is likely to interact with a person who has a hearing impairment, When providing or participating in a form of therapy that requires the student and/or therapist to see the other person's face. By students who cannot medically tolerate a face covering over the nose and mouth, when necessary as protection from possible contact with bodily fluids. A face shield should be worn in combination with a washable face covering by employees who must interact with others at a distance of less than 6 feet. Layering the two has been demonstrated to provide additional protection for the wearer. Examples include when contact with a student with special needs is necessary, conducting a transaction with a member of the public in a location not protected by a plexiglass barrier, conducting symptom screenings on employees, students, and/or visitors for COVID-19 symptoms. Intensive prevention measures are those that can provide additional protection for employees who must work with persons who are known to have or are reasonably suspected of having symptoms associated with COVID-19. N95 respirators and disposable isolation gowns should be available for staff working in the health office and/or isolation areas. A face mask should fit snugly but comfortably against the side of the face. The face mask should be secured with ties or ear loops, allow for breathing without restriction, completely cover your nose and mouth. Cloth facial coverings should be laundered frequently with hot water and detergent. Remember to wash your hands after removing a reusable mask. Facial masks or cloth coverings should be discarded when they no longer cover nose and mouth, have stretched out ties or straps, do not stay on the face properly, have holes or tears, and are visibly damaged or soiled. Parameters for common spaces in classrooms. Space seating and desk at least 6 feet apart. Turn desks to face in the same direction rather than facing each other. Students need to have their personal items labeled with their names and kept in their designated spaces. They should disinfect all personal items each day and may not share these items with anyone. Increase opportunities for spending time outside while maintaining social distancing. Limit use of shared playground equipment in favor of physical activities that require less contact with surfaces. Staff should clean and disinfect frequently touched surfaces within school and on school buses frequently throughout the day. Only use EPA-registered and district-approved disinfectant solutions in restrooms, classrooms, and hard surfaces. Frequently touched surfaces in school include, but are not limited to, door handles, light switches, sink handles, bathroom surfaces, tables, student desks, and chairs. Staff will document as they clean throughout the day on the provided cleaning log. Disinfection of commonly used hard surfaces is performed and documented by classroom staff. Ask students to move to another area while cleaning their space and maintain social distancing protocols. Chromebooks and headphones should not be shared. Snacks and meals are monitored and supervised by assigned staff members. Utilize more tables in outside area when possible to spread children out. All tables need to be disinfected before and after each snack or meal. Social distancing is maintained with taped markers on each table. Students should wash hands before and after eating. Staff members wear gloves if serving packaged food and change gloves if direct contact with a student or a contaminated surface is made. Avoid any cafeteria-style meals and do not allow students to help themselves to any plastic utensils. Students may bring personally labeled water bottles and lunch from home, and they must be kept at their desk or with the student during lunch and recess. Personal water bottles are only allowed to be refilled by staff. Reusable water bottles and lunch pails should be sanitized at home each day. Students may not share food. If staff or student has any COVID-19 symptoms, please refer to the staff-student COVID-19 symptom procedure that will be provided to each school site. These steps include to place a surgical mask on individual and take them to the designated isolation area until the individual leaves the school site. Students must still be visible and supervised by a staff member. Keep 6 feet or more distance between student and others. Contact student's parent or guardian to pick up student and advise them to follow up with their doctor. Notify all individuals in close contact with staff, student presenting COVID-19 symptoms that they must quarantine themselves for 14 days. Notify on-call district nurse by phone. An individual is considered to be in close contact if they were within 6 feet of a person who has or is likely to have COVID-19 for more than 15 minutes, within 48 hours before the individual's symptoms began and until that individual is no longer required to be isolated, had unprotected contact with body fluids and/or secretions, including but not limited to being coughed on or sneezed on, sharing utensils, or drinking out of the same container of an individual who has or is likely to have COVID-19. In order for students and staff to return to school or work, all of the following must be met. They must be fever-free for at least 3 days without the use of fever-reducing medications. Their symptoms must have improved, and it must be at least 10 days since their symptoms first appeared. As a reminder, all student and staff health information is confidential and cannot be shared with other students or school site staff. Confidential health information can be shared only with school district health team leaders and county public health department.
If any staff member or student develops emergency warning signs for COVID-19, seek medical attention immediately. Emergency warning signs include trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips or face. Call 911 if you have a medical emergency. Notify the operator that you have or think you might have COVID-19. Notify the on-call district nurse and site supervisor immediately.
One district nurse will be on call for all sites each day during the summer program. The name and phone number of the district nurse scheduled for each day is listed on the Google Calendar titled District Nurse On Call Summer 2020. Call the on-call district nurse for health-related questions and any possible cases of COVID-19. The district nurse is only available for phone consultations. They will not be on campus. If a student with diabetes or any daily health procedure enrolls, health services needs to be notified by emailing Brisa de los Santos at least 1 week prior to the student starting. This gives the time needed for a healthcare specialist to be scheduled on site to perform the necessary health procedures. Call or email your assigned district nurse for health-related questions and any possible cases of COVID-19. Please review and be familiar with the district's 911 protocol. After emergency responders have arrived and taken over the situation, be sure to complete the confidential student accident report. Submit the completed form to risk management. Make sure you are aware of the location of the site AED and stock EpiPens. The location is different at each school site. Common locations include the front office, health office, NPR, and staff lounge. There are 2 boxes of stock EpiPens at each site. The yellow box of EpiPens is for adults or students 3rd grade and above. The green box of EpiPens is for students 2nd grade and below. Please review and be familiar with the district's emergency procedures. Emergency response for severe asthma, district seizure procedure, head injury procedure, snakebite procedure. We will continue to keep you updated with the most current public health recommendations. Thank you and have a great return to campus.